Well, a common problem that causes peeing in the house is urinary incontinence. Urinary incontinence is due to a weak urethral sphincter. It's just not tight enough to hold all the urine in the bladder, so when it becomes loose, dogs will leak out urine. The most common clinical sign is a wet spot on the floor or the rug where your dog is sleeping. Leaking urine can also cause the fur around the genitals to be wet. In that same area, the skin may be red or irritated, and so the dogs may lick that area a little bit further. But there are other causes for urinary incontinence. It's important that you see your veterinarian to make an accurate diagnosis. But I'm going to help you today. For dogs with behavioral urination, they're aware of it. So they're going to lift their leg or squat, or it's going to happen when they're really excited or nervous. When dogs have medical urinary incontinence, they're not aware of it. So they're going to leak urine when they're sleeping. And that's when you're going to see that wet spot on the rug or the floor.
So any dog can develop urinary incontinence, but it's most commonly seen in adult, older, female spayed, mid to large breed dogs. And if your veterinarian does diagnose urinary incontinence, there is a drug for it. It's called Pro-N-ER. And it's an FDA-approved, easy-to-administer, once-daily product that has been shown to be not only safe but effective for treating urinary incontinence in dogs. If your dog is placed on Pro-N-ER, it's important to keep an eye out for things like vomiting, diarrhea, loss of appetite, and if your dog does have high blood pressure, it will need to be closely monitored. So your veterinarian is your primary source of information, but if you would like to look for the product, go to proen-er.com.